Shyama Mishra to give us more updates. Shyama, good afternoon. Welcome to Midday Prime. Are the mock drills being conducted in Mumbai, and which are the areas that are under particular consideration, especially when it comes to a city like Mumbai?
Well, Anil, when we are talking about COVID-19, we have already seen, rather Maharashtra has already seen the worst of it. First wave, second wave, and the third wave. We've all seen the worst of it. In the third wave, we have seen that the cases of positive COVID cases had reached about, at around 68,000 daily. And now we are registering almost, 15 cases per day, 30 cases per day all over Maharashtra. There's a need, because we are seeing that there's a surge in cases in China, Japan, US, and other countries as well. So there's a need to buckle up and be, have your preparedness ensured that you are having all your necessary requirements ready in place. We are here at JJ Hospital, and this behind me, if you see, this is the whole infrastructure, which is a sort of temporary infrastructure, but they have put it here for permanent, usage of the COVID patients. So the mock drill that was conducted, it was conducted over here. There's an entrance right besides this infrastructure, and a patient, a dummy patient, who was COVID positive. He came in an ambulance, and then he got himself registered here, and then he was then sent to another office where the swab was collected. He was then made to wait a little while for his reports to come, and based on his seriousness, if he's not that serious, the report will come the next day, and if he's very serious, then the report will come in in a matter of few hours, and then he'll be shifted to a transit ward which is set up here at the JJ Hospital. When once the confirmation comes, then from here they'll be sent to another hospital, which is the COVID dedicated hospital. So in Maharashtra, in Mumbai, we know there are several COVID dedicated hospitals, and there were jumbo hospitals as well. But for now, as the number of cases came down, these jumbo COVID cases were told that once the need rises again, only then they'll be functional again. So right now, 21 private hospitals, then 10 BMC-run hospitals, 3 government-run hospitals. These are the hospitals that are there in Mumbai, and we also know for the fact that people were getting less tested these days because less and less number of COVID cases are getting registered. So the state government has urged people to get themselves tested also if they have flu-like conditions. And for that, a daily capacity just in Mumbai is more than 1,35,000 in 49 labs and other hospitals as well. So we are talking about, having all the preparations of getting tested also, and if you're positive, then how to go about it. The whole process has to be seen. So that was we can say a sneak peek today, and with this, all the information will be given to the wards. I get the larger point. A central.
I get the larger point that you are making, but how does the BMC, for that matter, that handles health in Mumbai, get stock of the situation, especially when it comes to testing more people? Is there random testing that's happening in a city like Mumbai, or are people left to test themselves as and when they see symptoms?
I fear it's the second option, because when you have to go to some place where it is said that your COVID test is mandatory, then people are getting tested. If they are having flu-like conditions, then people are getting tested. So there's no, because we are seeing in whole of Mumbai, there's only 5 cases coming yesterday. We saw the 5 cases came yesterday. Before that, it was much lesser than that. Sometimes it is more than this number, but the numbers have been, very much under control. So people are not told to go and get themselves tested, but they are going themselves, and if they feel that they are having flu-like conditions or COVID-like symptoms, then they are getting themselves tested at the nearest, you say private lab or the government-run center where they can get themselves tested. But yes, now we are seeing that the government is also asking people to avoid the crowded places, because it's the time of the year when people are celebrating, people are getting in parties. 25th December, that is Christmas, is already over. Now it's the time for New Year. So New Year parties are lined up, and that's why this is the time when the COVID cases rises. So government is definitely trying to make people aware that they should be caring for themselves, for their family, for the society. So have your COVID appropriate behavior. behavior back. We were following that, but as the number came down, as we started becoming more confident, we left having, we left using that COVID appropriate behavior. But now it's the time. Now is the time to take it back. So we have to follow all those necessary precautions. Have a sanitizer bottle with you. Keep your hands off your face, off your eyes. Wear a mask. We are also here, at the hospital, and we have ensured that we all from media fraternity, we wear a mask so that other people who are coming here to get themselves, for treatment, not just COVID, but for any other ailment, they also should be wearing their masks and protecting others as well. So it starts right from individual to individual, and then it goes to the state level, then to the country level. But yes, from the country level, if we are talking about the perspective, the government of India is definitely telling people that you should be aware that there could be a rise in numbers, and that is why hospitals in the first place have to be prepared. We have to ensure that all the necessary staff, ambulance, medicines, PPE kits,
Okay.
everything is in place, beds are in place, and that's how today the whole picture got clear, that how many beds. So the whole picture, as I've mentioned, the information would be given to the wards. All these hospitals which
Okay.
fall under particular ward, they will be submitting it to the ward, and then the wards would be submitting it further, and then the whole of information from Maharashtra would be then given to Government of India, where the portal will be having all the information. So yes, Government of India will have all the information as to where is the lack, where's the loophole,
Okay.
how can be fixed, how soon it has to be fixed. Everything would be at a bird's eye view.
Okay, clearly some lessons learned there from the 3 waves of COVID that we have seen, and appreciate you sending the message out to the people there, wearing a mask, asking people to once again get back to that earlier days of getting your mask, your sanitizers, and all that were precautionary that need to be followed there. Thank you and appreciate you joining us this afternoon.